Hi, everyone. Thank you for joining us today. On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Caitlin Copenspire, and I work for Kaufman and Associates. I'll be the moderator for today's webinar. Before we begin, I would like to highlight the main feature of your webinar interface. First, in the main window, when you see the PowerPoint slides, to the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. However, today's question and answer period will be at the end of the presentation. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You'll receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I would like to welcome everyone to today's webinar. Today's webinar is entitled Identifying Our Needs, a Survey of Elders, Data that Makes a Difference for Our Native Elders. Our presenter today is Collette Adamsen, MPA. Collette is the director of the National Resource Center on Native American Aging at the University of North Dakota School of Medicine and Health Services. Thank you, Collette, for taking the time to join us today. I will now turn it over to you for an introduction to today's topic. Thank you.
Hi, everyone. I'd like to start off by thanking all of you for being a part of the webinar series. I'm so glad that you can all join us. So I'm Collette Adamsen, the Program Director of the National Resource Center on Native American Aging, and I've been with the center for about 4 years now. Back in October, I was put in the position of interim director, and then in January, I became director. So before that, I was project coordinator for the program for over 3 years. And I really enjoyed working with the center and being a resource for our Native elders and our Native elder program. I truly love what I do. I enjoy work every day. So with that being said, I want to begin the presentation. So identifying our needs and survey of elders, data makes a difference for our Native elders. So I'd like to start off with providing you a little bit of a background about the National Resource Center on Native American Aging. We're one of 3 centers that are funded by the Administration for Community Living. We have 2 sister centers, the National Resource Center for American Indian and Alaskan Native and Native Hawaiian Elders, which is located in Alaska, and the director there is Jordan Lewis. And our other sister center is the National Resource Center for Native Hawaiian Elders, which is located in Hawaii under the directorship of Collette Brown. For our resource center, the NRCNAA, we were established in 1994 under Dr. Alan Allery, who was an enrolled member of the Turtle Mountain Band of Chippewa. Dr. Allery dedicated 30 years of his life to advocating for American Indian people and for our Native elders through the center. We started the program back in 1994, which our center has been held at the Center for Rural Health in the School of Medicine and Health Sciences at the University of North Dakota in Grand Forks, North Dakota since 1994. The mission of our center is to identify and increase awareness of evolving Native elder health and social issues. And our vision is to empower Native people to develop community-based solutions while honoring and helping to maintain their cultural values. So I'm going to give you a little bit of background about our programs and resources that the center offers. To just give you a quick, brief list of the resources we have. First, we have the Identifying Our Needs, the Survey of Elders, Well-Balanced Program, which is Wise Elders Living Longer, the Native Elder Caregiver Curriculum, a Service Locator Map, the Heroes Project, and I forgot to list there our Native Aging Visions newsletter. So to begin with, I want to talk about our main project, Identifying Our Needs, the Survey of Elders. This project is, as I mentioned, funded by HCL, And our needs assessment assesses the health and social needs of Native elders and tribal communities. And this needs assessment runs on 3-year cycles. It provides tribal communities the opportunity to collect information for their tribal communities about their Native elders in terms of health and social issues. And then also, we provide technical assistance through the whole process. So if your tribe is participating with the survey, we're available to you by phone or email. So if you need any help, we're there for you from start to finish of the survey process. We also offer training at the request of the tribe or the Title VI director that we're working with. And we can provide that training online or in person if our funding allows us to at that point. So I guess I'd like to just kind of talk about what a needs assessment is, just to have a better understanding about what our survey is and does. So a needs assessment allows us to understand and identify health and social issues. We have to determine what is going on in the community among our Native elders in terms of health and social needs to find out what areas we need to find resources for. So after you finish conducting the needs assessment, you actually have a documentation that tells you the story of your elders in your community. And from there, you're able to better assess and recognize the different needs in particular areas. You also have data results with statistical numbers that assist you in the tribe in planning and where to distribute resources and funding for those particular needs. And also, in addition, the data can be used to apply for grants to strengthen your argument for a particular need that the assessment has identified. And from there, that will improve the chances of securing resources and funding to address the need and bring in those vital programs into the community to serve our Native elders. But overall, the needs assessment provides you with information and data that tells us what is going on in our community and where the biggest needs lie, and we can address the needs and find community-based solutions through bringing in those additional resources and funding to develop programs to address that need. And then ultimately, we will be improving and reducing the number of health and social issues for our Native elders. Overall, it will just help us to provide a better quality of life in terms of health and social needs for our Native elders, which is really important. So the needs assessment provides us with a data roadmap. On the side, I included a picture of a road with going all over and questions on the sign. But once you conduct your needs assessment, all the questions on the sign will be answered in terms of who, what, when, and where the health and social needs lie or are occurring within your Native elder population. It gives us a snapshot of our Native elder population and provides us with trending data in terms of health and social needs, providing us insight on which areas we need to address and find solutions for. And all the questions on the signs will be answered through the data provided from the needs assessment that you conduct in your community. So in terms of tribal diversity, the Research Center uses a research model that attempts to address diversity between and within the tribes. So we know that each tribe is unique and diverse, and that is why we use a research model that attempts to address this diversity between and within those tribes. We know that the measures of local needs is unique to that particular tribal community, so we try to use a custom fitting measure and attempt to use a research process that acknowledges that a one-size-does-not-fit-all approach with the tribes we work with. And we know that each tribe has unique cultures and circumstances, and we try to be respectful of each tribe's diversity. So like I said, we try to adjust this research process knowing that a one-size-does-not-fit-all, that there's diversity within each tribal community, and we definitely have to take that into account in our research process. So the population that participates in the survey are usually Native elders that reside primarily on reservations, Alaskan villages, and Hawaiian homesteads. For the most part, we work with Native elders that are eligible for services for Title VI, so they're usually the ones that are participating in the needs assessment. Also, they are aged 55 years and older, and for this, I thought it was important to note that a Native elder who's 55 years and older is considered to be comparable to non-Native elders 65 years and older in the general population, and that has to do with the fact that the life expectancy for our population, for the Native population, is 4.4 years less on average than compared to the general population. But each tribe differs in this as well, because some of those statistics are even lower, and there's a larger gap in life expectancy for particular tribes in particular areas. So our needs assessment, the sections we have on our survey, excuse me, I'm kind of battling a cough and a cold. But the survey's news data that we have is pretty comprehensive, our survey, but it includes sections such as general health status, diagnosis of chronic disease, to ADL, to healthcare access, and all the way down to demographics such as age and gender. So here's an example of our survey. This is our new survey, cycle 7. So just to give you an idea of a couple of the questions, so this is page 1. Question 1 asks, would you say your health in general is excellent, very good, fair, or poor? Question 3 asks about chronic disease. Has a doctor ever told you that you've had any of the following diseases? And then here's page 2 for our survey. Some of the questions there are, have you been diagnosed with Alzheimer's disease, dementia, or other problems with memory or thinking? To questions about healthcare access, what type of healthcare coverage do you have? And then also, one that I thought was a good question was, when you are sick or need professional advice about your health, choose the following do you usually go? And for the options there, I thought it was really good that we included traditional healer, because it kind of allows us to bring in some of the cultural competency and sensitivity to some of these questions, where we include some of those Native elders that might think of a traditional healer for their healthcare needs. So that data would also be really valuable in maybe securing resources or programs for Native elders that prefer, cultural aspects to their healing. Page 3, we have, for example, some questions. Over the past 30 days, what vigorous exercises do you do? Another example, which is a really good question, I think, is, do you take care of grandchildren? And are you the primary caregiver of your grandchildren? That's another example of the questions. And then the last page, question 60. Are you now using, or if at some point you became unable to meet your own needs, would you be willing to use the following services? And they have a choice there. From anywhere from adult daycare, government-assisted housing, and long-term care services. So that just gives us a good idea, that question about what services are needed within tribal communities. And then, of course, we have general demographic questions, which are gender, age, education, and employment. So our research model and process, we start out with, first and foremost, we tell the participating tribes or the Title VI director we're working with that we need a tribal resolution for permission from your tribal government in order for that tribe to participate in the survey. Otherwise, if we don't have permission, we won't be able to process your surveys. We've had circumstances where some tribes have put in a lot of work in collecting their surveys, but then they weren't able to get their tribal resolution in, and that's usually sometimes because tribal elections were happening at that moment, and it was really hard for them to get signatures on the tribal resolution. So we really encourage the tribes that are participating to get that tribal resolution right away. But I do want to point out that you can still start, like, request your surveys and start collecting your data without the tribal resolution, but when you send it into process to us for processing, then that's when we need the tribal resolution for sure. So when you contact us, we'll ask you for an elder count. This is usually the number of Native elders that are being serviced by Title VI. And then from there, we'll take that number and calculate a good random sample number. And that number just basically is telling you this is the number to shoot for to get a good representation of your population. So the results will be that much better and more true to what's happening in the population. From there, we'll send you out your surveys with some helpful guides such as how to get started, an interviewing guide for the survey, general template on how to fill out your grant applications using the data, and then also a sample resolution if you need that. And then we ask that a trained staff member or volunteer from your program administer the survey to the Native elder, because there might be medical issues or some miscommunication about the questions that makes it hard for the elder to understand. So we always encourage to have somebody administering the survey for the Native elder. So once we send back the surveys, once they're all completed and collected, then we end up scanning it through our scanner and converting it into like a statistical software package where it allows us to analyze the data. And once we analyze that data, we get the results for the tribe. And those usually include frequency tables and a comparison sheet for the tribes to compare themselves to the tribal aggregated data and national data numbers. Also, I want to point out that the tribe owns their own data. Because of our agreement through the tribal resolution, the tribe owns their data. We only store it for them on a secure server. We cannot analyze any tribe's particular data for any other reason besides, sending them their own results, unless the tribe requests that they're applying for a grant. We've had this before where they're applying for a grant and they ask us to analyze the data and create some graphs for them that they should put into their grant application. So we will do that for tribal communities that request that. So with the comparison sheet, here's an example of what the comparison sheet kind of looks like. This is just the first question, but you'll have about 20 pages of these columns and information. So here we have the question, the response, and then your tribal data, the general health, your tribal data, the aggregated tribal data, which is all of the tribes that participated in the survey combined, all of that data and those results, and then the national data, which is the general population data. So the tribe is allowed to compare their results to the tribal aggregated results and the national data, so they can kind of have a better understanding of where their Native elders are sitting compared to those two groups in terms of health and social issues and needs. So here, I just wanted to give you a little bit of an example. This is data from Cycle 6. I know it's kind of hard to read right there. So it's the Alzheimer's dementia disability question section that we had on there. And so what I did was I just kind of did some simple frequency numbers and created this graph. So here we can see that 4.2% of our Native elders were diagnosed with Alzheimer's disease. From here, we can see that 80.8% of Native elders felt that their wishes were listened to and respected in terms of the type of care they wanted or required. So this is just, like I said, a simple frequency bar table graph that I created just to give you an idea of how you can utilize some of that data. Also, here's another section. This is another bar graph, just set up differently, but on nutritional health data for our cycle 6. So we can see here 35% of our Native elders take 3 or more prescription OTC drugs a day. 23% have an illness condition that affected kind or amount of food they were able to eat. So this is good data for us to use in maybe securing resources or funding to help address some of these issues with nutritional health for our Native elders. And then here, this is a trending bar graph. So as I said, we have different cycles of data. We do it every 3 years. So going back to cycle 3, all the way up to cycle 6, that's 12 years of data. So when we look here for the family member caregiver, from the Native elder that has a family member who's caregiving for them, we can see the trending data. So in cycle 3, it was 42.5%, and then fast forward all the way to cycle 6, it's 33.7%. So it's improved. Caregiving for grandchildren, that was from 31.3 to 28.3% over a 12-year time span, so it's slightly improved. But then we look at this area here for primary caregiver grandchildren. We didn't have this question on the previous cycle, so we only have one cycle of data for that particular question. So you can kind of see a difference with, if you participate in all the cycles, you can kind of see if you're improving, if that area is remaining stagnant, or if it's becoming worse. So it's really valuable in the sense that it helps you to see what direction these health and social issues are going in. So here's another graph that I wanted to just give you an example of. So here we see kind of the decrease by gender and among Native elders. So the yellow line represents female Native elders, and the purple line represents the male elders, Native elders. So as we can see, high blood pressure, diabetes, they're kind of around the same for both genders. But then once we get to arthritis, Native female elders have a higher prevalence. And then we get to depression, and it's almost 1.5 times more than the Native male elders. And then when we look at osteoporosis, it's almost 5 times more than Native male elders compared to female Native elders. So this also gives us some good information, maybe in programs for something to address osteoporosis for Native female elders. So these are just simple graphs that I just wanted to give you an example of how we can use or set up that data so that you can maybe put it in grant applications or other reports you may need it for. So the uses of data for tribal communities. So when we look at a community level, you can use the data to review your grants, specifically Title VI grants. Today we're driven by a number world. They always want to see what's going on, and they need to see that number to show proof what's going on. So it helps to strengthen your grant proposal by having this documentation of the Native elder health and social needs. It can also help in tribal planning and infrastructure. So the tribes can take this information and see where the greatest needs are and allocate funding or resources towards those needs. At the national level, it can help to train our Native elder service providers to provide better culturally sensitive and competent care to better serve our Native elders. It can also advocate for resources and funding at the state, regional, and national level And another important one is filling the research gap for Native elder information. I know myself, even as a person who advocates to try to raise awareness about Native elder needs, I have a hard time finding current or recent information about these certain topics or areas. So it's good to have that information out there now through the needs assessment survey. Also, training Native researchers in the Agin field. This is a big one too, to help our own Native research be able to go out and know more about the dermatology field and how to help our Native elders and to address their needs and find solutions. So it's good to have our Native researchers because they understand our population very well. Decision making and policy. So legislators will probably end up seeing this information. So if they see a need or the numbers show a great need, those are the areas or programs they are going to allocate funding to. So it's important to get this information in front of those policymakers to advocate and secure resources for Native elders to help improve their quality of life overall. So now I'm just going to give you a little example of our needs assessment participation. So here's a pie chart. And if you look at cycle 1, that was over 18 years ago, we had 9,403 elders participate with 190 tribes represented. Fast forward to 18 years later, cycle 6, we had 18,134 elders, which was almost twice the amount of participants, so almost double, and 267 tribes are represented in this current cycle. Overall, we've had 89,436 surveys collected since we began the needs assessment survey. So just a summary of our last cycle, just to give you an idea of participation and representation within the nation. So the data was collected from April 1st, 2014 to March 31st, 2017. And as I said, we had 18,134 American Indian, Alaskan Native, and Native Hawaiian elders participate. That represented 164 sites and 267 tribes. And there's representation from 11 out of 12 Indian Health Service regions, 9 out of 10 Department of Health and Human Service regions, and 28 out of 50 states. So we had a really good representation from those areas. And now we began cycle 7 on April 1st, 2017, and that will end March 31st, 2020. So here's our program, Well Balanced. This is an example of a program that was developed because of our data. The numbers show the need that needed a solution. So this program was developed by Dr. Lori Redding, who was a physical therapist and was the director of the Wellness Center at the University of North Dakota. They found a need whenever they were looking at our data. So the top 5 chronic diseases in the 12-year period. So when we look at this chart, this is a trending chart from cycle 3 to cycle 6. So we can see that diabetes, high blood pressure, and arthritis remain consistently the most prevalent chronic diseases among the Native elders that participated in the survey. Then today our data, cycle 6, shows tribal aggregated data, and all 10 regions show us that, again, diabetes, high blood pressure, and arthritis are the top 3 chronic diseases that are prevalent in our Native elders. And then we look at fall trending data. So this is over a 12-year time period also. And you see from cycle 3 to cycle 6, it goes anywhere from 38 to 39% of our AIAN elders have experienced 1 or more falls in the past 12 months. So through the data, there was a need identified. So Dr. Redding was working with the NRCNAA, developed the Well Balanced program, which is Wise Elders Living Longer. And it was designed to help promote falls prevention, strengthening and balance, engaging in social activities. So Native elders, they're going out and being a part of this exercise program, but they're also socializing with their friends and other people who are taking part in the program, which is positive for their mental health as well. It also manages diabetes, arthritis, and high blood pressure, as I mentioned, because of the data that we've seen that showed a need. And it develops strategies for independent living while having fun. And about it, last fall, we created this video just to give you an example of some of the exercises that the Well-Down program has to offer. So I will let them cue up that video. It's about a 2-minute video.
Hi, folks. This is Caitlin with Kaufman and Associates again. We are queuing up that video and just wanted to let you know that because of Adobe Connect's functionality, you won't hear any audio, but that will not affect the information that you get from the video. And if you would like a link to the video, it will be posted within the presentation, which will be at cms.gov in a couple of days. Thank you.
So that is just an example of some of the exercises that are included in the program. In the actual manual, we have Native elders demonstrating the movement. For the video, we would have preferred to have Native elders in the video, but we were waiting for more interest. So in the future, we're hoping that we can have a video where the Native elders are performing the exercises. Our next resource or curriculum is our Native Elder Caregiver Curriculum. It is a training resource for family member caregivers and American Indian elder caregivers. And the NRCNAA model uses a model of network for delivery of elder care and community-based long-term services and supports in American Indian communities. Care of elders is the main focus that includes kind of branches off the traditions and culture, takes into account these areas of tradition and culture, health services and community provider, tribal, regional, state, federal resources, extended family structure, and family and friends as caregivers. The program was developed because we recognized that there was a want and need for Native elders to age in place in their homes and in their tribal communities. As we all know, the options for long-term care services such as nursing homes and retirement homes at times are not available in tribal communities, and they tend to be located far away from their homes. So the NACP recognizes that training Native elder caregivers will help keep the Native elders in their homes and tribal communities longer. The NACC also serves as a tool to assist community health workers and community health representatives to address the needs of the Native elders that they serve. But overall, the NACC was developed with the guidance about awareness of the modern context of rural tribal communities and the historically rich traditions and strengths of American Indian nations. And this is embedded in the framework of the NACC curriculum, which includes, just to give you a few examples of our curriculum, what the reasoning is for it, is helping family and professional in-home caregivers to have additional gerontology-related knowledge, help families learn how to access information from healthcare providers that is essential to planning and providing quality care and prevent rehospitalization, help families understand the healthcare payment system and eligibility criteria for Medicare, Medicaid, etc. And these are only a few examples of what the NRCNAA provides in the training. Our consultant, Chris, she doesn't believe in a canned approach to presenting the curriculum, and when she goes into tribal communities, she adjusts her training to meet the needs of the community, taking into account cultural sensitivity and competency. But if you're interested in the program, just please contact our center, and we'll give you more information. So here's our service locator map, and I was going to give a slight demonstration for this one. It's another resource that we maintain, and it's a web-based service. So if I could, I'll try to pull it up here. So this is right on our web page. So all you have to do is, if you're looking for, say you're in, I guess, Minnesota. So it gives you the areas where these services are, the tribal areas, and then you can just click on them, and it'll tell you what services are offered in that tribal community. And we'll usually try to update this often. We usually call the tribal communities and ask if, we still have these services or new services, that are made available.
Hey, Collette.
Yep.
Hey, real quick, we can't see your screen. Can you try to share your screen with us again?
Oh, yeah. Sorry about that. Here you go. I'm sorry, everybody. I thought my screen was being shared. Sorry. So here, okay. The example here. So can you see it now? Okay. So say you want to click on Arizona to see what services are available in tribal communities. So we can click on Hopi Tribal Council, and then it just shows you all the services that are provided in that area within the tribal community area. You can also do it by service. So I believe adult daycare. So it just shows you which areas have 1 to 2 centers, 3 to 4 centers by color-coded legend. So this is really helpful in trying to find services in your tribal areas for Native elders. And now, so our other project we have is the So our other project is the NRCNAA Heroes. And this project honors individuals who have dedicated their time, talent, and energy to help Native elders. These are your neighbors whose efforts often go unrecognized. Heroes are people who help build stronger communities by supporting and nurturing their elders. And these people are people who are making a difference for our Native elders within their tribal communities and even off-tribal communities. So for this program, we're actually currently accepting submissions for 2018. And if you have somebody in your community, a Native elder, or somebody who advocates for Native elders, and you want to recognize them, please submit a nomination, and we're hoping to recognize them at this next year's Title VI conference. And then here's our Native Agin Visions newsletter. This newsletter is just to let you know what is going on within our center. as well as offering information about our program, healthy aging tips, recipes, and at times articles featuring a Native elder. So if you have somebody who's a Native elder or someone who serves Native elders that you feel should be featured in our newsletter, just let us know and we can start the process of including them in our future issues. For example, in one of our last issues, we featured a Native elder female veteran, and she really had an amazing story. And I really, really enjoyed interviewing her and just learning a lot of different things from her. And it turned out to be a great story. It actually was republished in a couple of other local newspapers, so I thought that was really neat. So if you have anybody who's a Native elder or that you think deserves recognition or somebody who advocates for Native elders, please contact us and we can try to feature them in our newsletter. So with that, those are all of our resources that are available to our tribal communities for our Native elders. If you have any questions, please feel free to contact myself or our NRCNAA staff. I included our photos just so you could put a face with a name when you call us on the phone. And we also have a new project coordinator, Erica Gunville, and she's really nice and she's ready to help anybody who needs assistance, and she's more than willing to help in any way she can, and so are Cole and myself. So here's our contact information. If you need to get a hold of us or are interested in any of our programs that we have available, our resources you need, don't hesitate to call us or contact us by email. So with that, I guess, are there any questions?
All right, folks, so we're going to be moving on to the Q&A portion. So if you would like to submit your questions via the Q&A box, we would love to answer them.
So I see this question as a well-balanced program available nationwide. It's a free program that we offer. All of our resources are at no cost to the tribe. So we do, currently we're updating the manual. The original developer of the curriculum, Dr. Redding, she generously agreed to help us update certain areas of the curriculum. So we do have the new manual available at the end of May. Normally, how we do it is we like to train 2 coaches who would implement the program within the community for the Native elders. But if you do have somebody with like a personal fitness background or physical therapy or exercise science, I think you can probably navigate through the manual well. So you just call us and we can send you out a manual and the forms and help you in getting started with that program.
Awesome. So our second question is, what is the website for the service locator?
So that's just on our overall website. So it's www.nrcnaa.org. And then you would just go under, let me double check here. So you just go under the projects and services, and then just click on the service locator, and then it'll bring up the map, and then you can navigate the map from there.
Great, and that link is also supplied in the web link pod. So question number 3 is, in regards to the Mount dementia diagnosis in tribal communities, have you found that dementia is seen as a normal part of aging, which may prevent individuals from seeking care? Are health literacy initiatives in this community, are there health literacy initiatives in the community regarding this issue?
So I think that now that we're becoming more aware of Alzheimer's and dementia and actually what's going on with it, I think people are recognizing, like Native elders and tribal communities, I think they're starting to recognize it more. With the health literacy initiatives in the community regarding this issue, I think there's more interest in this area, so now I think we're starting to collect more information and data in this area to try to start defining the needs and seeing what's going on within our population so we can develop solutions or programs to help in this area. Although Alzheimer's is not a curable disease, but just, to help have some sort of resources out there, offer care and things. So.
Thank you. Question number 4 is, how many elders typically participate per tribal site?
That ranges a great deal because some are consortiums where, some tribes only have 1 or 2 people and then they combine it, into the consortium. So we've had anywhere from, 10 surveys sent in to 600 surveys sent in. So it just depends. Depending on the size of the population with that elder count, that's where we determine the amount that you would have to collect. And usually that number is a good representation of your population. But usually they try to collect at least 30 to 50, because that'll give us some okay data for you. So the more is better for that.
Excellent. Okay, the next question is, are there any questions on opioid use being included in the survey?
Not at this point. We haven't looked into it in depth. But maybe in the future, we could maybe look into something for cycle 8 surveys. But at this point, no, we haven't. But sometimes that needs to be a sensitive issue too. So sometimes we have to find ways to word our questions so we're not sounding too invasive either.
Great, that makes sense. The next question is, would you suggest the CDC BRFSS as another reliable source for American Indian or Alaskan Native elder population data?
Well, in actuality, we used some of the purpose questions or modified some of the questions when the survey was first started. But normally their sample size is much lower compared to ours. And they don't, for our survey, we have the participants identify whether they're American Indian, Alaska Native, Native Hawaiian, descendant, or other. So then you can actually see specifically what area, what that participant identifies as. But with the purpose data, they kind of lump it together. So your one population. So it's a reliable source, but the numbers aren't as high for the sample. And like I said, they lump them in together. So for the AIAN and Native Hawaiians and things.
Great. So I just have a couple more questions for you, and we're running close on time. So we're going to do a few more questions, and then, Collette, is it all right for people to reach out to you via email if they have any more questions?
Yeah, definitely. You can contact me email or phone.
Awesome. Okay, so I'm just going to give you 2 more questions. Is there any surveying planned for urban Indian communities?
At this point, we're really looking into it, and we're hoping we will be able to offer that. So right now, we're kind of in the beginning planning stages to see if it's possible for us to do. So we can definitely keep everybody updated on that too as we find out more information.
Great. And our final question is, do you publish aggregate data state by state or by IHS regions?
I guess we haven't published any of the data, especially on our websites or anything, but Right now, we're in the process, we're trying to work on publishing some of the aggregate data on the Agin website, so we're hoping to have that available soon or in the near future. And I believe that's just overall, like, just the whole tribal aggregate. But we can break it down to state by state or IHS regions for other publishing areas or sites.
Great. Well, thank you so much for all of this information today, Collette, and thank you for presenting. We'd like to thank everyone for being here, and we hope you had a great experience. Keep your eye on the cms.gov website for this to be published, and have a great day.